Thank you, Matt. Thank you, Mike, for the paper. And to prove I've read it, look, there's the scribble. Well, let's leave these questions up there. And on the last one, I'm already thinking yes. So in my response to this paper, I just want to outline some potential answers to that particular question, but also to pose some other questions. And William this morning already nicked a couple of my questions around curriculum crowding and at what level maybe should we use this sort of knowledge. And I don't want to throw those questions away. I think we can still further explore those particular questions. My response to this paper as a nurse educator with a sociological background is to try and make sense of it. I was asking myself, well, if I was a student of nursing, how would a paper like this help me in my understanding of nursing practice and my education generally? So that's one broader category that I want to think about as a student of nursing, how would I deal with a paper like this. As an educator of nurses, a similar sort of question: does this paper help my teaching practice and my facilitation of learning? And if it does, in what particular ways? And the third category I'm thinking about to myself, it was around the curriculum itself, how curriculum are developed and reviewed. And already this morning, I think Ian alluded to the question of what a question I'm always asking myself is what is a curriculum for? What's the point of nursing education? I have some thoughts on that, but in answering that question, depending on how you answer that question, papers like this can be seen as either totally irrelevant and useless and clogging up the curriculum, or you could say, actually, no, this ticks an awful lot of boxes. And from the student perspective, when you read the title of this, you might hone in on the word sex, so that might get your attention. So, well done for the chaps for the title, because if you try to entice students to read a paper, I think putting sex in the title might be one way of doing it. But that relates also to an issue around the language that we use, because often papers I read have some brilliant ideas that make me think differently about things, but they're written in such a way that I would never pick the paper up in the first place. So that's one reflection. Not that I'm suggesting that we all run away and put sex in the title of our papers from now on. But it might be a plea for the clarity of language, which, if you've ever read the book The Sociological Imagination, C. Wright Mills, in the first chapter, beautifully demolishes Talcott Parsons for using obscure language and theory rather brilliantly, which I often use and share with my students as a way of how sometimes good ideas can be obfuscated by poor academic writing. And thank you again this morning for your insights about those writing modes, because I think that is really helpful. It gives me confidence. From the student perspective, then, Ian mentioned this morning about the spirit of engagement, and so I'm thinking, well, how does a paper like this help a student be more actively engaged in their educational practice? Would it be so? And one of the words you used was activism. And I'm thinking, well, actually, yes, there is a core of activism in this paper because of the issues that you're discussing and explaining. There are human rights issues in there, and we had a little conversation over lunch, and I thought, well, if I was a gay man, how would I feel about this sort of classificatory system and the way it would treat me and my altruism towards blood donation? Now, that's a great idea for students to explore for themselves. Why not? And if that leads to some sort of personal action, some civic action, some political action on students' part, 3 or 4 years down the line, great. So I think a paper like that can help a student in the development of that sort of process. As an educator, what is my role? And if I want to be very, very pragmatic about this. I can pick up a paper like this and think, why would this knowledge be useful at all? Where in a curriculum could I use it? And of course, a moment's reflection, there are several modules. I might use a paper like this. Modules to do with public health, modules to do with evidence-based practice and the use of scientific knowledge and the construction of scientific knowledge. More specific clinical modules around those nurses who are learning around GE medicine, STIs and blood-borne infection type of learning activities. A paper like this could support activities. A question for myself as an educator is, what exactly is my role in taking a paper like this into that learning space? And already this morning the issue of what's the level that we should be bringing this in, undergraduate or postgraduate. Well, I think, I'm already thinking I could use this in undergraduate teaching, but my role might be different in that I would hesitate, given the wide entry gate that my university uses, in giving that paper to first-year student nurses and say discuss, for obvious reasons. So my role might be a bit more interpretation or using key ideas from the paper and referencing this paper and say, look, this stuff is good stuff. I might help you, you might need some help to understand some of the key concepts. Maybe at a postgraduate and a master's level, you could say, discuss. That's for me to try and work out. So where, at what level? Now, in curriculum terms, in curriculum terms, when I'm thinking, well, how can I use this stuff? I'm an enthusiastic sociologist. The question for me, is this stuff useful? Has already been answered 1,000 times over. We've been very enthusiastic. Yes. For me personally, sociology was an emancipatory discipline. It was libertarian, gave me liberation, and it's more to. Very briefly, my background was I left school at the age of 16 and joined the Fleet Air Arm. So I was 7 years working on seeking helicopters. So I was an aircraft mechanic. Then I left and did a couple of years social work as a volunteer social work, thinking, what do I do now that I've left the Royal Navy? And while I did that, I became a Christian. Not just an ordinary Roman Catholic or Church of England soft Christian, but your hard-nosed, fascist, Pentecostal, born-again Christian. And forgive me if anyone's like that here, but it is probably fair to say that their paradigm is quite narrow. So I came from a military paradigm, and an evangelical Christian paradigm, and then I started reading A-level sociology. And I can personally vouch for the emancipation and the liberation reading multiple paradigms and perspectives gives you. So from a student perspective, what's the goal of education? What's the curriculum for? I fall back on scripturals for typologies. And one of those typologies for education, he answers, is that education is about, the label he uses, progressivism, personal growth and self-development. This doesn't need to further my nursing practice. This is about learning about me and some of the issues about the paper, like deconstructing sexuality, for example, and looking again at the notion of heterosexuality. For some people, it would be the first time they've ever done that. I thought, oh wow, there's different practices. I had no idea. I remember that feeling myself as a student. A second reason for curriculum development is what Scrimshaw calls social reconstructionism, i.e. that what you learn in education has a social aspect, that civic action might flow from what you learn. And I think some of the human rights issues that you mentioned in this paper, as I've already said, could form part of that. The third is the liberal humanism, which I think you've already mentioned, is knowledge for knowledge. It's just great to learn stuff and to encourage ourselves and our students just to learn. So it doesn't give you knowledge for anything, just learn it. And I do this, I'm a bit of an eclectic reader myself, and happily sometimes I find there is a use for some of this stuff that I'm reading. but that's not necessarily why I do it. So it could be just a good thing to do anyway. And finally, is the last one, instrumentalism. Education's for a purpose. And within nursing, it's to, what Melinda was talking about this morning, was about I need to be able to go to clinical practice and be able to do stuff based on knowledge. The sciatic nerve, for example, you gave a nice illustration. So those are 4, for me, domains that the curriculum can take us in. And I think a paper like this can support each one of those domains. And time of now cut me off, otherwise I could wax lyrical for half an hour about how that could happen. So I throw those sort of questions out for us. From a student's perspective, what might this mean? From a nurse educator's perspective, what might this mean? And from a curriculum perspective, how might this sort of fit into what we're trying to achieve? Thank you. Right, we've got 10 minutes, is that right now, for a little bit of chatting around the table, stretch your legs, bit of a comfort break, and then we'll come back for the